Good evening. My name is Clara Sanguinetti, and I'm a student project manager at the Clark Forum for Contemporary Issues. On behalf of the Carlisle Health and Wellness Hub Foundation, College Relations, Human Resources, and the Clark Forum, it is my pleasure to welcome you to this evening's program, 7 Steps to Your Best Possible Health Care. Speaking today will be Dr. Ruthann Russo. She is this year's Metzger-Conway Fellow, a fellowship designed to bring distinguished graduates back to the college for a short residency. Dr. Russo is a 1980 graduate of Dickinson College. She has also earned several additional degrees, including a doctoral degree from Touro University in business administration with an emphasis on healthcare management. Her talk will be based on her book, 7 Steps to Your Best Possible Health Care, a book that was reviewed by President Barack Obama, who provided supportive testimony of her work. At this time, I would like to ask you that you turn off all cell phones and electronic devices. Also, please hold any questions until the question and answer session at the end of the program. Because this event is being taped and some of our audience members may be hearing impaired, please wait until the question and answer session to ask your question. I would also like to remind you that immediately after this program this evening, there will be a book signing session with Dr. Russo in the lobby. Now, please join me welcoming Dr. Ruthann Russo.
Good evening. I'm happy to be back here after many years, almost 30, which is quite a long time. And what I'd like to talk to you about today is the healthcare system and each of our roles in the system and what we can do. The book I wrote, 7 Steps to Your Best Possible Healthcare, does detail 7 specific steps. But I'd like to actually expand that a little bit because, as you know, as I've found actually, you should never really put a number on something because numbers can change. And the new number is 10. So you'll actually get a little card towards the end of the session today with some additional information. But I'd like to just start out talking about the healthcare system and the paradoxes, 2 specific paradoxes that exist in our healthcare system today. One is the fact that we spend more per capita on health care than any country in the entire world, yet we still continue to have some of the highest rates of chronic diseases, and specifically in the world. The second paradox is the fact that we have, undoubtedly, as many of you probably have experienced, and those of you who haven't someday probably will, we have the most complex system in the world in terms of the paperwork, the administration, and many other challenges. And yet, with this complexity and the fact that many of us don't understand it, at least not fully, we rely upon this system to keep us healthy and in some cases to save our lives or the lives of our loved ones. So here we are with these paradoxes. And what this can often lead to is a feeling of disempowerment, not being an empowered healthcare consumer. And so how do we flip that paradigm on its head, and what do we need to do to get to the point where we are empowered health consumers? We feel as though we're in control, instead of, as many of us often feel, as though we are essentially passive participants in the healthcare process, where we find ourselves listening more to what our physician is telling us to do and following his or her advice only and not taking our own steps. And oftentimes the confusion, the stress, the complexities of the system itself can actually lead to additional stress on us, which can make us less healthy. And so this whole circular action has to end somewhere. One of the places that it could potentially end is with each one of us taking some steps to change things. And that could just be one step, by the way. It doesn't have to be all 7 or even 10. And what I'd like to do is talk to you about some of the research that I've done and some of the suggestions that I have for all of you. And then certainly at the end, any questions that you have or comments, I'm certainly willing to engage in that as well. So with this concept sort of weighing heavily out there, what we decided to do, the research team that I work with, we decided to actually ask the question, what is it that healthcare consumers who have positive outcomes, what is it that they all have in common? And could we potentially trace something or more than one thing that these individuals have in common? So the way we conducted the research was really twofold. One was that we did case studies, and I actually delved in depth into 8 particular individuals, and later tonight you'll actually see some film clips. Some of them actually graciously allowed me to film some of the interviews that I had with them, so you'll hear from them in terms of some of the actions that they took. So one piece of the research was really doing some qualitative research where we spent a lot of time with 8 individuals who had what I would call positive outcomes in healthcare. And that doesn't mean perfect. That doesn't mean these folks weren't living with some sort of chronic condition that they had to treat or had to actually manage on an ongoing basis. But they themselves defined their outcomes as positive. So that was one piece of the research. The other piece of the research was a web-based survey, which actually asked not just survey questions, but actually asked people to tell us about their positive experience. And it's amazing how much people will write. Literally, some of these responses, people were writing 6 and 7 pages about their positive experiences, which in some instances, when you actually read them, they weren't positive experiences. They just wanted to write. So what we did was we actually surveyed 2,000 individuals and then kind of went through that data to identify what, if anything, do these individuals have in common? And what we found out through an analysis of the data was the fact that there was one common theme throughout pretty much all of this information and all the data that we collected. With these individuals, those individuals who had positive outcomes were more likely to be participant planners in the process. In their healthcare process. Okay? They were collaborators with their physicians. They weren't just an individual who sat and listened to what their physicians told them to do. They were proactive. So they were planners, they were proactive in the process. And so that was essentially a key component, or the key component of this process. And so since that time, since the research, and we conducted that research back in 2006, I've had a lot of discussions about this with different groups. And there's a question that I usually ask, which I'll actually ask all of you. If you could think for a minute about an event in your life, an event that you have had to plan. So maybe it was a large birthday party or an anniversary for yourself or a parent. If you're still in school, maybe it was spring break, a spring break vacation. Whatever that event might have been, if you could just think about that for a couple of minutes and think about the amount of time that you put into the planning process and the amount of resources that you put into that planning process. And now, I'd just like you to think for a minute about your health care, your own health care process. And the question is, how many of you, and you don't have to actually raise your hand, this is really rhetorical or for your own purpose, how many of you spent more time planning the event than you did your health care? And in most cases, we spent a lot more time planning the event than we do for our health care. It's just not something that, I don't know if it's that we've not been taught, or it's something that we have as a country, as a culture, come to expect and rely upon our physicians to do that for us, to be the proactive individuals in this process. And they're the ones who are involved in the planning, not us. Okay? Now, it turns out that these individuals with positive outcomes in healthcare, not only were they planners, not only were they proactive, and not only were they collaborators in their own healthcare, but they had a very specific way of approaching this process. And that is that they created some vision for themselves. Now, they may not have done this consciously, but after several interviews and many discussions with these individuals, what we found was that they all had some picture, some snapshot of themselves in the future that was really their starting point for their planning of where their health care was going. So, for example, one of the individuals, and you'll actually see him on the film clip, is at the time was a 39-year-old insulin-dependent diabetic who was insulin-dependent since he was 12 years old. Had multiple diabetic complications, still has multiple diabetic complications, and probably is treated by anywhere on an average of 8 to 12 different physicians at any time. His vision for himself was that he would see his 5-year-old daughter walk down the aisle when she was, he guessed, somewhere in her mid to late 20s. So this man had a vision of himself as not necessarily the best health, but he had a vision that he would be well enough to walk his daughter down the aisle in some 20-odd years. Then there was a breast cancer survivor whose vision was that she saw herself playing with her grandchildren, and her daughter at the time was 21, not married, not anywhere close to being married. So who knows how many years into the future that particular vision took her. But the point is that she had the vision. And my favorite vision, who actually was not one of the individuals I interviewed for the book, but is Lance Armstrong. And if anyone here has read It's Not About the Bike, you know that one of the statements in the opening part of that book is that his vision for himself as a cancer survivor, which he is and continues to be, but his vision for himself at that time when he wasn't so sure that he would be a healthy cancer survivor, as he is today, was that he would be crossing one last finish line with his wife and 10 children standing at that finish line. And at the time, he had one child. So you're talking about at least 10 years that he saw himself in that process. So this is the starting point from a visioning perspective. And as a practical matter, I guess we really shouldn't be that surprised about the importance of vision, of the visioning process. For years, business researchers have told us about the importance of, have actually researched and identified the importance of having a vision as an organization. We know that organizations who have visions that are reflective of that organization are more likely to be financially successful than organizations that don't. And then, of course, we also have Stephen Covey, whose first step in the, I'm trying to actually use my terminology on Stephen Covey, but 7 Habits of Highly Effective People. His first habit is that successful people are proactive, and the subtitle for that is creating a personal vision. And so this visioning concept is not something that's new. However, it is something that I'm not so sure we apply when we think about our healthcare and that process. And maybe, just maybe, given some of the results that we saw from these 2,000-odd individuals who participated in some way in this research, maybe what this tells us is that extending your vision into the healthcare realm, and not just a professional component, however you might vision yourself professionally in 10 years, or what you want in terms of wealth and what you've accumulated in 10 or 15 years, but really expanding that vision to include your healthcare, your health, your wellness, whatever term you want to use. And so what I'd like to do is talk a little bit about 3 of the individuals who were part of the case study research that we did, and what they actually went through. You'll see some film clips. But when we talk about, in just a couple of minutes, but when we talk about this visioning process, that's a start. You still have to fill in the dots somewhere. You have to fill in the blanks with something. And that's where we need some sort of ideas, direction, whatever you want to call it, to get started with the process. And so the first thing that I'd like to suggest that we consider once we've taken control, or at least decided that we want to take control of our own health care, is that we become the leader, the quarterback of our team, or whatever analogy works for you, the orchestra leader, whatever works for you, that you become the leader of that team. So if you are still, for example, a student, my guess is you're probably very healthy, or many of you probably in here are very healthy, don't have any particular health conditions or problems that you're concerned about. Or for those of you that do, of course, that's fine as well. But for those of you that don't, it doesn't mean you have to be sick in order to think about this process. In fact, the chances that you will have a better outcome if you think about the possibility prior to anything happening are probably much greater than if you don't. And again, that comes from some of the positive outcomes that we saw with some of the research that we actually conducted. So again, just thinking about this concept of actually working with this process to create your vision. And what that might mean in terms of becoming this empowered healthcare consumer. So creating the team may vary depending, again, on what your specific issue is. If you've got a chronic condition, you may need to pull together a team of specialists, a team of medical and surgical specialists. And as a practical matter, that in and of itself is not that easy today. In this country, we have over 250 different medical and surgical specialties. So as a consumer, without some type of assistance to help you wade through this process, it can become very cumbersome. But let's say you don't have a specific chronic condition or acute condition that you need to be concerned about. Who might be on your team? What might you be thinking about? Some suggestions might be a nutritionist, someone who is involved in fitness. If you're someone that is potentially into some alternative type of areas, yoga, meditation, those types of things might be individuals that you might want to consider having on your team. No matter who the individuals are that you have on your team, however, you want to make sure that you've got a primary care physician who is really the coach. That's the coach of your team, the individual who will help you lead and pick the right people. And today, picking the right primary care physician is key. Today, as any day. Primary care physicians, in fact, I've often had individuals in groups where I've asked the question, how many of you are happy with your current primary care physician? And many people have raised their hands. And when I've asked why they chose not to change or why they are with a physician where they are not happy, the response is, well, I don't want to make him angry. Or I've been with this physician for 10 or 15 years. How can I possibly leave? The particular physician has become sort of ingrained in that individual. So they felt as though they didn't actually have the opportunity to leave. So in creating your team, again, thinking about who needs to be on that team and some of the information that you need to wade through in this process is something that I would encourage you to think about. What I'd like to do now is show you a very quick film clip of one of the individuals who was part of the case study. And this is a post-research interview that we had, in which he's actually talking about, he and his wife, and most of the people who, by the way, are on these films, what you'll see is they brought someone with them. They felt a little bit more comfortable being in front of the camera if they had someone with them instead of just themselves talking about their healthcare conditions. But what you'll hear is them talking about some of the challenges that they've had with different medical and surgical
Especially with
specialties.
all the specialists and all the physicians now, everyone seems to be so specialized that I feel like no one is ever looking at Jay's overall health. So I took off from work, and I'm sitting there, and the podiatrist would come in, then a antibiotic specialist would come in, then the cardiologist would come in, and no one seemed to be talking to anyone.
Managing your diabetes and how that's going?
Yes, I'm on the insulin pump, and it has changed my life. I have never felt better. I've had diabetes since I was 13, so I'm on 26 years of being diabetic. And for the past 2 years since I've been on the pump, it's been fantastic. My A1C has actually come down. But if I can say one thing about going back, about taking control, a big thing that we do now, no matter what doctor I go to, I make sure all my other specialists get a report from each doctor so they all know what's going on with my health. Because before that, he would know, but I would never have the update sent to another doctor. So now when we go, they all have a list of who my doctors are, and I send everything gets sent to all the doctors that I go to, so they're all up to date.
Okay, and actually, Jay, who is the individual that you just saw, brought another issue in that I'd like to talk about for just a moment. You can see, obviously, some of the stress that they had to go through with all the different specialists, but essentially how they were able to overcome that was, number one, by finding a really good primary care practitioner who worked for them, who was somebody that they could work very well with, and really by taking charge. And one of the things that he took charge of, you heard towards the end of the interview, was his health information. And that is one of the biggest challenges that we have, again, in this country in the healthcare system, is lack of good technology and health information. Most medical records today are still paper. And when you ask for a copy of your medical records, which, by the way, you have a right to because you own your health information, however, if you want a copy of it, you pretty much have to pay for it. But if you ask for a copy, you might be lucky to get a disc, but chances are, especially if you're getting your medical records from a hospital, you'll get a pile of papers, of Xeroxed papers, because that's essentially the way things are. But the biggest issue with technology is the lack of coordination, and you heard Jay talking about that, where he said, he would go to his cardiologist who didn't know that he had an issue with maybe a diabetic ulcer, and he didn't know that because the report wasn't sent to the cardiologist. So he realizes now that it's his responsibility to make sure everybody in the chain gets that information. And if that doesn't happen, the likelihood that he could have less than optimal care will probably be likely. So again, this is part of an individual actually taking steps, proactive steps, to ensure a better outcome. And in his case, it's actually been looking better and better every year for him. And a lot of that is because of these steps that he's been taking. Now, another thing that I'd like to discuss is the concept of a medical mentor. It might be a new term to you. It's a term that has been used more and more by hospitals who are now training people, especially in some of the specific areas like bone marrow transplants, other organ transplants, where hospitals are training individuals who have had this experience to be medical mentors, to actually mentor patients who need to have this condition, who need to have a certain condition treated. That's a specific type of medical mentor. But another type of medical mentor may be someone that perhaps you've interacted with in your own need for health care, or you may have actually acted as a medical mentor and not actually called yourself that. It's really someone who is a trusted individual who will work with you to work through any healthcare problems that you have, but is not necessarily a healthcare professional. So this is someone who will help you with the planning process, who will be a moral support, and probably one of the most important parts of the credentials or the criteria for this individual is that they need to feel comfortable communicating with healthcare professionals. Because oftentimes what you will find is that, especially if you or someone who needs healthcare is very ill, you don't feel that great. You don't want to have a conversation necessarily about your health every day when you've got doctor visit after doctor visit. So if you can have someone helping you with that process, again, more likely to help lead you to better outcomes. And actually Vera, who will be the next patient that we'll listen to, can probably explain it a little bit better to me, a little bit better than I can, because she, in fact, used her sister as a medical mentor. Vera was diagnosed with breast cancer. At the time of this taping, she was 3 years cancer-free, and today she is almost 6 years cancer-free.
When I was first diagnosed, I was in a state of shock. I was extremely distraught. I'm a very emotional person, and my family supported me and helped me through everything. But my sister Mary Ann, she provided me with the ability to make rational decisions too. She got copies of files for me. She made appointments for me. She sought second and third opinions for me. She actually accompanied me to many of my doctor's appointments.
So you actually...
But she was there. I can't imagine going through it without her. And she made everything so much easier. A tough situation, she helped me and made everything much easier. I don't think I could have gone through this without I would not have gotten the quality care without her making some of my decision. My husband, my daughter, my whole family was there for me for everything. However, she really, really made the process so much easier. That we have much more inner strength than we ever dreamed. I used to be afraid to even have my teeth cleaned, and I learned the power of the human spirit as far as your friends, your family.
Thank you. Okay. Thank you. And thank you, Mary. And that was a positive outcome. And again, I can tell you that the first set of interviews that I had with Vera, she was not even, I think, a year cancer-free. So she wasn't feeling quite as confident then, but still had a very positive perspective on what was going on and was extremely proactive in managing her care and proactive with her sister by her side. And so in this particular situation, it was the individual really acknowledging the fact that it wasn't something they could do on their own and looking for some outside help. Now, that might be a family member, or for some of you, it might be someone who is a healthcare professional. Again, it depends on each individual. And that's really where this whole planning process comes into place, because everybody's plan needs to be specific to them in order for it to work for you. There's no vanilla way to do this. It's something that you really do need to spend some time on, and it is your future, your health. And so, again, it's a decision that you or all of us really need to make. There's one last film clip that I'd like to show you, and this is really around the healthcare insurance issues. And again, in this, again, the complex system that we have, healthcare insurance is usually the issue that most people think of right away. Yes, it's complex. I have to file 10,000 papers. I have to pay a deductible, and then they tell me it's not the right amount, or whatever the issue might be. My bill's been rejected by the insurance company. It's not being paid, and I have to pay it on my own. These types of issues. Or do I even have the right health insurance coverage that I need? And so, again, what I would recommend, and what we saw based upon the interviews and the data that we collected, was that individuals who had positive outcomes around challenges that they might have had with health insurance issues were really individuals who took action from the beginning with their health plan. So that most of these individuals had identified a person at the health plan who they interacted with. They had a name of somebody who they could call when they had questions. It wasn't just information back and forth in the mail or some other way. It was a personal relationship. So that was one piece of it. And the other part of it was that the individual really understood the health plan requirements, and they also understood when they were potentially going to be outside the health plan requirements and what they needed to do. The film clip that I will play for you in just a minute is a couple, David and Natasha, who found out when Natasha was, I think, 6 months pregnant, that their daughter had a congenital heart defect and would need to be operated on literally within 2 minutes of the delivery. And what they also found out at the time that she was diagnosed was the fact that, guess what, her health care plan was out of network for the only hospital and group of surgeons in the Philadelphia area who did this type of surgery. And they were also informed that this probably would cost them somewhere in the neighborhood of $600,000, which of course none of us could afford. And so what they did immediately was that David had a contact at the healthcare plan, who he had established that contact with them years ago when they first actually started with the plan, and called to find out what the next step was and what he needed to do, because this wasn't obviously an option for them. They needed the surgery and they didn't have the money. And so what they did was work with an advocate. The health plan had a third-party advocate that was really, as a practical matter, an employee of the health plan, but they worked through this process. And in the end, they actually did have to pay some out-of-pocket expense, which I think was, he said was around $6,000. Today, he's still not exactly sure at this point, because it still was a lot of paperwork. I'm not saying it was easy and everything just flowed wonderfully for him, but they had a positive experience in the end with the insurance company. In fact, they actually are somewhat friends with their healthcare advocate now because of the great experience that they had. But I'll let you hear from...
Would send us the bill. We would then send the bill to the insurance company, who would then pay us the reasonable charge, or reimburse us the reasonable charge, which is generally about 10 cents on the dollar, or 20 cents on the dollar from what the actual charge was. And we would personally liable for the difference of the charge.
We went to bat for us and really got the insurance company to come around and realize that without this treatment, our daughter was not going to survive. It was the only option. It was the only hospital that would be able to perform the surgery.
I wasn't real happy about the situation then, but in retrospect, I do think that it worked out, amazingly well, and I think that we were pretty lucky to get that advice ahead of time from someone and actually get somebody from the insurance company that we could actually talk to and work with us and for us, actually.
Okay, so those are just some basic issues, some basic areas in terms of health planning, health insurance planning, understanding who needs to be on your team, and working proactively. There are obviously several more steps that you can take. I won't go into the detail of that right now because I'd like to talk a little bit more about wellness. But I do encourage you, if you have some interest in pursuing some of this further, the websites that you saw up there, and in a little bit we'll give out cards that have some websites on them as well. You can download a plan. There's something called Health Maps that's on there. You can download that, which will walk you through every piece of the planning process with potentially more detail than you desire. That will actually create a day-by-day plan for you. That's something that you're certainly welcome to do, and there are several other resources as well on these websites. But really, up to this point, I've really talked about or only addressed half of the issue, and that is the health care piece of it. That's the planning piece of it for who is on my health team, who am I working with to make sure that if I get sick, or if a member of my family gets sick, however you want to look at this, who am I working with and how will I make sure that we get the best outcomes? The other half of that is really the wellness component, which is planning to be well and to stay well, and what we can do, each of us individually, to ensure that. And so there's obviously a lot of things that we can think about in terms of this concept. In this country alone, the statistics are fairly scary in terms of the amount of chronic disease that we have: diabetes, heart disease, obesity. Robert Wood Johnson Foundation estimated just a few months ago that we have 9 million obese children in this country. So obviously we have a significant amount of issues that are facing us. And even more importantly, the current system of health care isn't adequately addressing all of those issues. So what to do? NIH came out, and some of you may have seen this just a few weeks ago, but NIH came out with a publication in which they basically talk about what Americans are doing, or what many Americans are doing on their own to fill the void that our current healthcare system doesn't seem to be able to do for us. And what they basically said was there are several actions that Americans are taking, and it's anywhere from 5 to, I think, a high of 17% was about where these numbers go. And not only are we taking the actions, but we're spending somewhere between $40 and $60 billion of our own money on this type of what they called alternative healthcare treatment or complementary healthcare treatment. What was interesting is what they had in the list didn't really seem like healthcare treatment at all. At least in terms of how we traditionally think about it. So the number one treatment, alternative treatment, that we use today is the use of supplements, non-vitamin supplements, things like glucosamine and chondroitin and ginseng, those types of supplements, fish oil. Those types of things are used by apparently 17% of us. I don't know exactly how they got that data. Seems like, to me, sometimes it seems like it's probably a higher percentage. But again, that's one way that the NIH, the National Institutes of Health, they've actually hypothesized that's one way that we're starting to fill the gap on our own. Now, a little bit more interesting are some of the other things that some of us are doing to fill that gap are things like, actually number 2 was deep breathing. I'm not sure who came up with that, whether it was a question that was asked or people just voluntarily said, I am deep breathing for my health. But that was number 2, and that was about 12% of us are deep breathing. So I'm wondering how many of us are all going like this and filling our abdomens with air and expelling it right now. But, and we do know that there's been some research out there, at least, that tells us we know that deep breathing can help. It can help lower our blood pressure, some of the things that our autonomic nervous system does for us naturally. So that was one of the other things that we're doing. Some other things that NIH had on the list were yoga and meditation. And another thing was chiropractors. I think that was about 5%. But the point is, not necessarily what these things are, but the point is that we are spending our own money outside of the healthcare system where we have some entitlement to have our healthcare paid for. We're spending our own money and looking for care outside of the current system to fill the gap that we know exists. And so the question is really out there, which is what can we do or what should we be doing? And that's really part of the plan that you need to, again, fill out for yourself in terms of the future and what your health care will in fact be. What's the wellness plan that you have for yourself? And some of those ideas that came from NIH are things that you may already be doing or you may be thinking about. But one thing that we do know is that taking these steps and being proactive, you're more likely to have a better outcome. And that's whether it's you or someone in your family, your parent, your child, etc. So again, thinking about what the possibilities might be for you. I'd like to talk about some options, some that there's been some specific research done on in terms of the efficacy and the successfulness of, and some things that we just know naturally. So for example, meditation. How many in here have ever meditated? Great, okay. So the numbers continue to, or the percentages continue to increase. Anybody here familiar with the University of Massachusetts mindfulness-based research or mindfulness-based stress reduction program? It's actually founded by Dr. John Kabat-Zinn. It's been in place for about 20 years. They have treated to date somewhere in the neighborhood, I actually just had a class with him this summer, and I think he said it was somewhere in the neighborhood of about 40,000 patients. And actually what they did was they partnered with the pain clinic in the hospital and actually taught what we commonly call meditation, but he felt that that might be a little bit too Eastern and mystical for people, especially 20 years ago. So he renamed it mindfulness, and he defines mindfulness as paying attention on purpose, in the present, letting go of judgment. And so basically what he does is he teaches the participants in this clinic to meditate for periods of up to 45 minutes, and he recommends six times a week, so literally almost every day. And he walks them through 4 different methodologies that they can use for meditating. One is yoga, simplified form of yoga. Another is something he calls the body scan, which I can tell you whenever I do, I fall asleep, which isn't the purpose, but actually, scanning your body and focusing. It's basically focusing on the body and not thinking about anything else. And then sitting meditation, which is probably the more common, and he also has a walking meditation. But the point is that what he's been able to do is effectuate some change. He doesn't call it treating patients, but effectuating some change with these patients, most of whom are coming to him because of pain initially, but now he treats cancer patients, he treats patients with depression, with anxiety. So he's actually been able to show the organization that the impact he can make, or the patient can make, I should say, when practicing some form of meditation or mindfulness extends out into many different types of individuals, not just pain. And today, that program has been extended to almost every academic medical center in the country in some way, shape, or form. Some places are just doing it in a pilot form right now, but it's something which has been so successful in terms of being able to have a positive impact on our health care that we've seen every academic medical center really taking root with this. So again, something that you might want to think about in terms of if this type of activity could have a place in your life in terms of your own wellness planning. And the last thing that I'd like to talk about is food. Food is obviously something that we are all involved in eating on a daily basis. And it's interesting because I had a conversation a little bit earlier today with someone on campus who said that her physician told her that her condition had absolutely nothing to do with the food she was eating. And I've heard that actually from many physicians, when in fact we all know, whether intuitively or because there is some degree of research out there to support it, but we all know that we are affected by what we eat and what we drink. It affects how we feel, it affects our level of activity, our level of energy, and can affect our overall wellness. And so, one of the things that you might want to think about is your actual eating habits, and if there are potentially changes that you could make in those habits that could make you feel better. And if you feel better, chances are you're healthier. Now, here's the question. Again, what to do. We live in a country where today, I believe there are something like 70 to 80 different fad diets out there. From South Beach to Atkins to you name it, whatever you can make a couple of $1 million on by publishing it and saying it's a diet and good for you, we've got books about it. So those are things that we probably want to steer clear of. But what we do want to do is latch on to just some basic concepts in terms of what we know will be more likely to be good for us than not. So for example, drinking. How about the concept of drinking more water and less caffeine? It might not be the greatest suggestion, especially around finals week, but it's something, again, to think about. And there are other concepts as well. What about the concept of eating less sugar and more greens or something green, okay? The term green, I say that because we know that greens are so good for you. And sugar, again, might not, I was in not the bookstore, but the mart, right? I was just walking around today looking for some healthy alternative snack. I found some salted peanuts. That was the best I could get. And I remember when I was here many years ago, I can remember that we all waited very excitedly for the tray of donuts that would come out somewhere around midnight almost every night during exam week. Do they still do that? Okay, and I mean, I was the first one in line to be shoveling donuts. But the problem with that, of course, is that we all fell asleep when we were supposed to be studying because our blood sugar plummeted after it first, went up so high. But again, something to think about. I mean, I can tell you that I can proudly say that in the past 3 years, I have not had any refined sugar or sugar of any type. And I also don't use any type of artificial sweeteners, which again have their own set of issues. There are different ways that you can sweeten things like stevia, agave syrup, that are naturally occurring sweeteners that you can use without having the same type of issues that you have with sugar. So I'm talking about just a couple of basic things here, but again, something that you can think about in terms of your own wellness plan. Your own wellness plan starting with what's my vision of myself? And is that 5 years? Is that 10 years? Is it 20 years? I mean, you heard Jay, he was at 20-some odd years out thinking about his vision for himself. And my guess is that he will be walking his daughter down the aisle in 20-some years. And without that vision, chances are probably less likely that that would happen. So what's your vision? And what's your plan? Who's on your team? Who's on your team now? If you don't have a team, who should be on your team? And where will you, as the leader of that team, lead that group? And knowing that you have control over that group. You need to change the members of your team out. That's your prerogative, and we all need to feel that empowerment. And I can tell you, and I'm not sure how everybody here in this room feels, but I can tell you that the majority of healthcare consumers in the country today do not feel that sense of empowerment. And so the sooner that each of us can start towards that road of ourselves feeling empowered, maybe impacting a member of our family, a parent, a child, in some way, the sooner that we can begin to see some of these positive results, feeling as though we are, in fact, empowered healthcare consumers in control of our healthcare. And so where we are today as a country, obviously, we've got a lot of things going on that we probably would rather not like to think about at this point in time, but we do know that under President Barack Obama's plans, healthcare is one of the top 3 or 4 issues up there. Sure, the economy, obviously, and what's going on over in the Middle East are the top 2, but healthcare, no doubt, has a top priority. I think about when he first took office and he talked to all of us about the need to volunteer, the need to come out and do some good. And if each one of us could volunteer, whatever that might be, in some way, we can make a positive impact. What about the concept of volunteering to change one thing about your health planning or your wellness planning process that could impact you positively? And maybe if you could impact one other person, this type of activity could potentially have a ripple effect that could, guess what, create some positive impact in the healthcare system that doesn't cost another cent, which would be really nice, especially where we are today, right? So again, it's just some information that I'd like to put out there for you all to consider. Some decisions that, maybe something that you'd like to actually engage in thinking further about. It may not be, and that's fine. But I hope you'll at least give it some thought and also pass on the information to others who you know, who you think might benefit from taking these types of actions. And I do have some cards which I think we're going to give out. And I'd actually like you each to take a couple of them so that if you know someone who you might be able to share a card with. And this is why I say never put a number on something, because when I wrote the book, 7 Steps, these are now 10 ways to improve your health care and 10 ways to improve your health. And again, just some things to think about. And the websites are on there as well. As I mentioned before, there are a lot of free downloads and information that you're certainly welcome to take a look at. I'll just wait a second till everybody has cards. Okay, and that's actually it for me. If anyone has any questions, I'm more than willing to answer them. Or if you have any comments, I'd love to hear them. Thank you. Thank you all. Thanks for your attention. Sure.
Most of the suggestions that you shared were at the individual level. Most of the suggestions that you share were at the individual level. What about the kind of control you can exert more broadly other than volunteering? You could choose to work for a company that has better health care, or you could move to Canada.
As Michael Moore would have us do, right?
So what are some of the, and maybe you cover this in the book, but some of the steps you can take other than at the very most individual level?
Right. Well, I think the one suggestion that you had about the company, choosing the company that you work for, the corporate or the organizational activities that can occur that can actually impact very positively is certainly something to think about. And that's not only from a health insurance perspective, but even from a wellness perspective. For example, when your organization has a meeting and you pull everybody together, what do they feed you? Donuts and coffee, or blueberries and, I don't know, decaf tea? I'm not sure, whatever, somewhere in the middle. But do you have a healthy alternative? What is really the perspective of your organization in terms of the wellness of the employees? And that goes to, we could look at school systems. We could go to all different organizational levels, the government. But school systems certainly in terms of the food that our children eat. I know, I don't know about all of you, but I know until my son finished high school last year, as a senior in high school, I was still packing his lunch, or his father was, if I wasn't home, packing his lunch for him so that he didn't have to eat the stuff that they served in the school cafeteria. And he was actually very much in favor of that. He didn't want to eat the junk. And so that just tells you a little bit about some of the priorities that are askew. And I'm sure some of these things are coming up on the table, but again, because we have so many priorities today in the country, chances are that probably won't be one of the top 2.
All our meetings, we have water and salted peanuts, so it's really good here. One of the things you mentioned, interacting with your primary health care provider, talking to your doctor and so forth. The difference between, planning your wedding or your birthday and planning your health care is this huge, information asymmetry, right? There's this person across the table who knows a lot more than you, and he's got or she's got 6.5, 7 minutes, and they have to be moving on. I mean, they don't have time to sit down and chat about your healthcare future and what you would like and so forth. And so, many are just resistant to that. So what do you do to say, no, sit down, please. I need another 10 minutes with you to talk about where I want to be in 20 years and, all of the rest of those things that you talked about. How do you, and yeah, you could find another physician, but are they out there? I mean, can you find somebody who's got time to do that, to educate you about things that you really don't know much about?
Well, I mean, I think the evidence at this point is fairly anecdotal, and I can tell you that some of the individuals who were involved in the study did exactly that, and some of them were on 3rd and 4th and 5th tries with physicians, but even that alone takes time. That takes a lot of time. I mean, we had one individual who went into detail with us about how he interviewed the receptionist, went to see the office. But again, this is somebody who had some extra time on his hands, but also was really engaged in the process of planning his health care. One thing that I do recommend, and I do talk about in the book, is making sure that you're as well organized as possible for that 6 or 7 minutes, and if you can make it 10, that's great. But making sure that you know exactly what the issues are that you want to have covered, and don't let the physician actually drive the conversation. Make sure, in fact, I actually recommend that you bring the list and give it to the physician. And I know a lot of the people in the study do that. They actually write all their concerns down. So that's something that isn't going to necessarily expand the amount of time that they're willing to spend with you. But again, making the effort to find another physician, and also thinking about who's on the team. Is there somebody else who could play some role for you that maybe has more time? If you had non-physicians on your team, we've got folks that have physical therapists, acupuncturists, as we had talked about this a little bit earlier today, who work in tandem with physicians. That's a possibility. But ultimately, I think it's really about being as knowledgeable and as prepared as you possibly can. And for those patients or healthcare consumers who don't have the ability to do that for whatever reason, that's where potentially someone like a medical mentor could really make a difference. Sure.
If you had any luck, has anybody ever thought about the possibility of you entering something in your own healthcare record? I mean, do you have the power to say, here's a list of questions, I'd like to put this in here, or I'm not really happy with this, I'd like to make an entry in my own record?
Actually, that's a really good question. And in fact, under HIPAA, which was passed in 1999, HIPAA, the Health Insurance Portability Act, Health Insurance Portability and Accountability Act, gives us not only the right to make sure that we know that we own our information and we can get our information, but that gives us the right to review the information, have it explained to us if we don't understand it. What they don't tell us is what the timeline is. So if somebody said, if you go to a hospital and say, I don't understand this information in my record, I want somebody to explain it to me, they could say to you, oh, well, we'll see you in 3 years. Or, I'm exaggerating, but there's not a time limit on that. But you do have that right. And you also have the right to request modifications to your records. In fact, my husband is, who I'm in law practice with, but he's, as I say, the real attorney. He has had, in the last 5 years, an interesting influx of, he represents a lot of physicians and hospitals, an interesting influx of patients who have come to the hospitals and the physicians asking for modifications in their records. And these individuals, it's the first time that's ever happened, and they don't know what to do, and they're afraid there's some legal implication if they allow the patient, because they don't know, they've not actually had the right explained to them, that it's mandatory for them to allow the patient to actually write there if they have a problem with whatever's in the record. They can't modify the physician's documentation, but they can state it and ask that it be put into the record. Now, there is some sort of appeals process that you can go through, blah, 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 back and forth. But the point is that not only do we have that right, but the patients are actually using it, which is a good thing. It means they're reading, not only are they requesting the records, but we're also reading them. Or whatever we can, whatever we can make out.
I'm a little bit disturbed by the onus that seems to be on the individual as a patient. Doesn't the medical profession have a responsibility to patients? Don't the corporations who make corn sugar and load up orange juice and grape juice with sugar, and people are buying these things, they have no idea what they're eating. I had a prepared, one of those fast dinners the other day, which I very seldom have, and it was advertised as chicken. It's mostly pasta with a few little bits of chicken in it, and a lot of people depend on these kinds of foods. So I think a lot of education has to be done, but people just don't have mentors. I mean, if you try to get an appointment with a primary care physician here in Carlisle, they're all leaving. You stay with the primary care physician because you can't find anyone else. So we have real problems, and it's wonderful to think about this ideal world of having a mentor. If you don't have a sister who can take care of you, you're going to have to pay for a consultant or a mentor. And if you call the doctor, they tell you to call the emergency room. You have to wait 5 minutes to even make an appointment. So I think we have a really screwed up system, and all the yoga and the meditation in the world isn't going to help because we're talking about physical ailments.
Right. Thank you. I hear you, and you're absolutely right. I mean, I agree with you about the need for education. We absolutely have that need. And the comment about the corn syrup companies, I'm with you on that. Definitely. And, I don't know. I mean, I guess yoga and meditation, all those things that's really an individual choice. If it's something that can help you or that you think can help you, great. If it's something that isn't really in your bag of tricks, really to each his own, and it is important to make sure that you do it on your own. As far as the primary care physicians go, we have been aware for quite some time in the country that there is a shortage of primary care physicians. The government's trying to make put some programs into place to encourage medical school graduates, or not graduates, but actually after their residency, to go to different places where we know there's a shortage. And so I'm not sure how long that type of thing will take to actually make an impact, but those are some things that potentially could help in the future. But I hear you. You're right. It's not fair. Yes.
I'm sorry. I think I've seen Russo and Ruthann on commercial before. However, when you defend that you were representing the doctors, and physicians and hospitals, as far as what exactly?
Oh, in terms of what I was just talking about, you mean?
I'm just looking at what you're saying. I'm sorry. I'm not familiar with Russo.
Oh, that's okay. It's just, yeah. It's a law firm, and my husband and I represent a lot of hospitals and physicians who recently, what I was just saying, have come to the hospitals and to physicians who've treated them, and they were unhappy with their medical records. So those entities came to us and said, we don't know what to do with this. We think could be a legal problem because we've never had to change medical records before. But yeah, those are just really... We don't do malpractice, no, because we represent hospitals and physicians. So we... No, we pretty much just we help hospitals understand the federal regulations, which unfortunately are probably as crazy as our health insurance regulations, so. Mm-hmm. Sure.
I just had a comment about not having enough time with your doctor. Recently, I made an appointment with my doctor, and I told him ahead of time that I had a lot of questions I wanted to ask him, and he set aside a half hour for me, not 15 minutes, so that I could have the time to ask him those questions.
Now, how long has he been, if you don't mind my asking, how long has he been your primary care physician?
About 15, 20 years.
Okay, so you have a long relationship, a good one. Well, that's great, and obviously that's probably the reason why he's been your doctor for that long. So yeah, and actually, that is a good point, though. And again, it might not always be the solution, but asking the question and letting the physician know. It's amazing to me in some of the conversations that I've had we did several focus groups, and we had smaller groups of people sharing some information, and the numbers of people who are afraid of their physicians, afraid to ask a question, very afraid to ask for a second opinion. Those types of fears are fairly prevalent, at least given some of the interactions that we've had. Which isn't good, because that can't be healthy, right? To be afraid of the person who's supposed to be making you healthy. Okay, any other questions? Yes.
I'm a nurse practitioner, and I think one of the real solutions to primary care in this country is to have more nurse practitioners in primary care, and the medical community supporting that concept of nurse practitioners. I also wanted to say to the lady that there is actually a healthcare advocate in Carlisle. She's a registered nurse and has her own company, and she's in the phone book, and I can't think of her name right at the moment. So if you need help with negotiating health care, you can give her a call.
Thank you. Thank you. Yes.
I was wondering, as a graduate student, what would be your advice for somebody who's entering the workforce and would you think that maybe it would be a priority to look for a job or
to look at different jobs and look at their health care plans and if they're covering their employees as a young relative?
Oh, in terms of the health care plan that's available to you and making a decision about where you go to work based upon that? Yeah, well, I believe that, and this is just my belief, that you can tell a lot about an organization based on the types of benefits that they offer to their employees. And generally, I've seen that organizations that are somewhat generous with their benefits are usually organizations that treat their employees very well. Now, with that said, and everything that's going on in the economy, everybody's kind of hunkering down right now. So you may see some changes in just in the last year that are different from what you saw previously. But certainly, I mean, you definitely want to look at what the actual health plan would be that is afforded to you. And many organizations have a buy-in, so to speak, into the health plan in different ways, different levels that you could potentially participate in based upon what you think you need. It might be one level today, something else as you get older, have children, etc. So yeah, I mean, that piece of information tells you something about the values of the organization. And certainly you want to pick, well, I know this isn't your question, but I'm going to say that only because this is one of the main things that I learned here at Dickinson, which is that you want to pick where you work based upon a match between your values and their values. Because if they don't match, it's not the right place. It took me 13 jobs to find that out. But I also credit Dickinson for the fact that I kept on going until I found that right match. So. Yeah, Dickinson, actually, I'm very grateful for the education that I got here. And 30 years later, which I still find that hard to believe when I say that, but 30 years later, I still often think about what I learned here and how I still apply it today. So, yeah, so you guys, any of you who are students, you're very lucky. Yes. Type of plan that you actually...
Yeah, like getting a base coverage overall to cover if you get in a car accident or you get cancer or something catastrophic. But then for everyday use, just paying out of pocket.
Yeah, well, I don't know that I could actually advise anything specifically based upon that small amount of information. And I do think that the type of coverage that you need depends, again, on the individual. However, the whole purpose for insurance is, planning for the unknown, obviously. So I'm not that familiar with the type of plan that you're talking about. Yeah, so again, depending on maybe what your experience has been in the past, if that is something that would work better for you. The other thing that you could do is make sure that you go to a primary care practice physician who has a business manager. That's not just another physician. Because you're right, I mean, physicians aren't trained for the most part to be business people, and we find generally, just in our practice and working with physicians, that those that have business managers or COOs or whatever you want to call that individual are much more likely to have happier patients because there's not as many insurance issues. You don't get as many denials because they know they have a better process in place.
We have time for one more question.
Oh, just in time.
On behalf of Dickinson College, the Clark Forum, and our co-sponsors, we'd like to thank Dr. Russo for participating in tonight's program, and I would like to present you the token of our appreciation.
Oh, thank you.
Good evening.